One of the most common questions I get asked is, do I need muscle repair during my abdominoplasty procedure? In many patients considering abdominoplasty, there is always some degree of stretching or separation of the abdominal muscles. This is often referred to as rectus diastasis, and it can occur with pregnancy, weight changes, or simply over time. It often presents as a persistent abdominal fullness or loss of core contour despite diet and exercise. During abdominoplasty surgery, repairing the muscles in the midline is one of the key techniques we use to restore support to the abdominal wall, narrow the waist, and improve overall shape. This repair is performed using carefully placed internal sutures to bring the muscles back together in a controlled and deliberate way. It's not just about tightening, it's about restoring balance to the abdominal wall. At the clinic plastic surgery, this is carefully assessed and planned as part of your procedure rather than treated as an optional extra.